Hello out there, this is Bob with Thrive Wellness, and today's wellness topic is the exercise is medicine movement. So, move more for the prevention and treatment of chronic disease. So, this is a presentation I did on site at CIEC several weeks back, and now just posting to YouTube and to the Wellness portal. So, you guys are able to view this online and respond to the questions for credit in the Wellness program. Hope you guys enjoy. So, what we'll discuss today, we'll take a look at the exercises medicine movement from every angle, defining it. We'll talk about what's really pushing that movement forward, what's behind it. We'll take a look at some research that can indicate that in many instances, exercise is as effective as many prescription medications for common ailments. We'll talk about exercise and how it relates to longevity. And we'll take a look at how much exercise do we really need to see results. Of course, there's a basic recommendation out there from the American College of Sports Medicine, but there's also research that will indicate every bit of exercise we get can be beneficial for our health. And then we'll wrap up with Move More. What is your plan for getting more active? Kind of taking a look at that from a very individualistic standpoint. So, the Exercise is Medicine movement is a joint venture that was launched by the American College of Sports Medicine and the American Medical Association to promote the incorporation of exercise as a standard practice in patient care. So, right now, when you see your physician, it's probably rare that exercise or nutrition really is discussed. Oftentimes, when a chronic condition is diagnosed, the protocol goes right to prescribing some medication. So the exercise is medicine movement is all about bringing about a scenario where exercise is part of that patient care paradigm. So EIM goals include the promotion of the exercise is medicine concept with increased awareness and acceptance about all the good exercise can do in treating many chronic conditions. And also, kind of a secondary goal, taking that one step further, is the actual incorporation of exercise as a standard part of the medical treatment and patient care process. So, taking that one step further to actually implement exercise within the patient care paradigm. The exercises medicine movement has grown significantly over its 2 decades now of existence. Exercises medicine is now supported by the American College of Sports Medicine, the American Medical Association, the American Association of Nurse Practitioners, the American Physical Therapy Association, the American Fitness Association. It is now recognized and supported in over 40 countries with satellite affiliates. So, why the exercise is medicine movement? What is really driving this movement? The simple answer is research and science. There's been so much research over a number of decades now about the relationship between exercise and health. So we're not too far removed, really, from a time in maybe the 1960s and 70s, maybe going back a little further even, when the conventional wisdom about exercise was that when you hit a certain age, maybe into your early middle age period, that you really shouldn't exercise much. You really shouldn't put your body under too much stress, and that exercise could actually do more harm than good. It's kind of that thought, well, you don't want to overdo it because you're going to wear out your ticker kind of situation. And fortunately, we've come a long way since then, progressing maybe into the 80s, early 80s, when we began to understand some of the benefits more so of exercise, beginning to realize, at least at that point, that exercise is something that can help us lose weight or maintain weight and maybe feel physically better and feel stronger. But really, it took years and years, decades of research for us to arrive at our current understanding of really the vast benefits of exercise to the whole person. So the exercise is medicine movement really exists because it is now evident that across all ages, all fitness levels, that the application of exercise improves virtually all biomarkers of health. And the impact is so profound that the reality is that exercise has the power to halt and, in many instances, begin to reverse many disease processes. So I've probably led you guys a little bit with this next question, but what is the one prescription that can lower risk factors for 5 major chronic diseases without any side effects? If you guessed exercise, you are right. So exercise is medicine. In the next few slides, we'll kind of get into some of the research behind, again, what is driving this exercise is medicine movement forward. So evidence has been mounting for the exercise is medicine movement for decades. So we now have a really good understanding that regular exercise reduces risk factors for heart disease, type 2 diabetes, stroke, depression and anxiety, breast cancer and colon cancers, and a number of other cancers, obesity, and a whole variety of chronic inflammatory type conditions. One study in a 2013 British journal Medicine found exercise to be as effective as medications in preventing death from most common killer diseases, especially heart disease and diabetes. A 2018 British Journal of Sports Medicine study found that exercise was as effective in reducing blood pressure as prescription medications. Further, multiple studies are now indicating that type 2 diabetes can be reversed through a strict regimen of diet and exercise. A Harvard School of Public Health study found that exercise was as effective as prescription medications in reducing symptoms of depression and mild anxiety. So there's kind of a cascading effect when we exercise on our mental state. It really does enhance our brain chemistry, which researchers have found in studies like this does relieve symptoms of depression and anxiety. And taking that a step further can help reduce risk factors for things like dementia and Alzheimer's as we age. More on that in a moment. Your body on exercise. So when we exercise, there are a number of great physiological adaptations that take place to the stress and demand that we're placing on our body. Some of those are improved cardiovascular biomarkers. So our heart will beat more efficiently. The stroke volume, that is the amount of blood that is moved per beat, actually increases. This does a few things. This helps to more readily oxygenate our blood. It reduces our blood pressure. It helps to reduce our resting heart rate. Also, you see improvements in the blood lipids. So the good cholesterol tends to increase. The bad cholesterol tends to decrease. So a number of really positive things take place with the cardiovascular health. As was mentioned a moment ago, you see some really positive benefits with brain chemistry through improved mood and cognitive function, along with those good hormones that are released when exercising. We also see the release of compounds called BDNF, or brain-derived neurotrophic factor. So this can help stimulate the repair and regeneration of nerve cells, which can actually improve cognitive function, help us learn, help us improve our memory even. We mentioned a moment ago the benefits of reduced anxiety and depression. Exercise can help us improve our sleep and reduce our stress levels. It can help us feel stronger and more energetic, more confident. Essentially, exercise can help us reduce risk factors for all major chronic conditions. Or, as was indicated in many of these studies, if you already have a chronic condition, exercise can be a big part of helping to treat that chronic condition.